So my first question is now Ohio, the vaccine is now available to people 80 and older. So how significant do you think that is in the state's fight against COVID-19?
Well, anytime we get vaccines in people's arms, that is significant. You know that the vaccine is probably our best tool right now in flattening the curve and eventually getting through the pandemic. It provides individually people that sense of reassurance that they're protected. And then on top of it, each individual that gets vaccinated is less of a risk to other community members, family members around them. So this is really important. We all wish that we had an infinite supply of vaccines and resources to deliver those vaccines, but we don't. So there is a prioritization that has to exist, and those priorities are defined to us from the experts in the state and the governor's office, and then some further sorting occurs at the local level. But the 80-year-olds are the highest risk. So most 80-year-olds, they're demonstrably at higher risk for serious illness based on what we already know about the disease and the mortality and the hospitalizations and the negative long-term outcomes. So it makes good sense that we're prioritizing that group.
In your opinion, what do you think is the best way to expedite this vaccine? Because it's been a really slow process to get it to people. So what do you think is the best way to, speed up the process?
Well, it's going to take a variety of different things. So I think it all really starts out at the federal government level. And the federal government is coordinating purchasing the vaccine. It's going to be free for everybody, which is a huge help. And then distributing both vaccine and guidance to the states. And then the states are trickling that out into the local counties, and they're partnering with pharmacies and healthcare systems. So you can imagine the type of effort that requires. So I think that having everybody on the same page, working towards a common goal that we want to get everybody vaccinated. I think when we get sidetracked with talking about certain groups over other groups, that serves as a distraction and occupies time and energy that we could otherwise be spending just getting vaccinations in people's arms. And then continuing to report the successes that we have, because there are a fair number of people out there that are still hesitant about getting the vaccine. And at this point, we vaccinated millions of people across the country. And even in Ohio, we've already vaccinated over 4% of the population. And in the Northwest Ohio, we vaccinated 4.6% of the population. So we're off to a start here of getting everybody vaccinated. We want to get to that 70 plus percentage of people vaccinated so that we can get to that herd immunity that we know will protect everybody. So I think it's the coordination of all those things. I think it's reducing hesitancy, improving acceptance of the vaccine. And then when your time comes up individually, please register and go to whatever your vaccine provider is going to be, whether it be the health department or one of the hospital and healthcare systems in the area. Just make sure that you get it and use your own experience to influence the circles of people around you.
As you mentioned, there is still hesitancy about people who want to get the vaccine, including healthcare workers. So what do you think is the best way to get people convinced that the vaccine is safe, besides doing public vaccinations over the TV?
Yeah, I think there's a variety of things. I think that that's a really important question to ask, and I appreciate you having me on to take time to talk about it. I think that the more people who are hesitant see people go through this and not have adverse reactions, I think that some of those people will convert. I think there's some people that just fundamentally aren't ready for this and they're not going to do it. And my hope is that that's a really small minority of people, and that there are people who maybe are initially hesitant that are going to see the public service announcements. They're going to see people they know and trust, not only recommending the vaccine, but receiving it and doing well and not experiencing significant side effects from it. So I hope it's all those things that come together that influence people's individual decisions. I would also mention that vaccines aren't normally a real hot topic for most people. Most people consider it everyday business. So I imagine that if Jaden, if you go to your personal physician and at that visit and your doctor recommends a certain vaccination, you're not going to go post that on social media or even talk about it, because it's a rather uneventful occurrence. And most people just accept these things as an everyday part of life. You don't advertise that you just got a tetanus shot or you just received your MMR, because we've been doing this so long, and it's regarded as being safe and just simply uneventful. And I'm hopeful that as more people get vaccinated, it just becomes uneventful and it becomes everyday business. And people say, you know what, I'm going to get my COVID vaccination. And everyone says, oh, okay. And it's just a routine daily business, and we don't think much of it. So hopefully we get to that point where it's just commonplace. It's talked about in households, and everybody's on board with doing it.
There have been a lot of questions about ways to get the vaccine. So what is the best way? Because there has been confusion. So where do you see the easiest way for people to get the vaccine?
Okay, well, I would, in this area, I would direct people to ProMedica's website. If you go to promedica.org, regardless of what county you live in, and we know we have a lot of people in your footprint, Jaden, that live in different counties in Northwest Ohio and Southeast Michigan area, and we link all those resources together. In Lucas County, which is, the largest county in the area, these efforts are all being coordinated through the health department. So you can also go to the health department's webpage and you can actually pre-register. So if your priority group isn't up yet, so if you aren't 80 plus and then the next week, the 75 plus group, if you're not in one of those age groups, you can still pre-register. And so that when your time comes up, you'll already have done that work and you can actually schedule an appointment when your group comes up.
There have been a lot of questions about this as well. Some people are just getting the first dose of the vaccine, but they're not getting the second dose. What do you think of that?
Yeah, I haven't heard that happen yet, Jaden, because we're preparing in a way that when somebody comes in for their first dose, we automatically schedule them for their second dose, and we have not had a shortage of vaccine that has put anyone out for their second dose. And I haven't heard about that happening in the area. Maybe it's happened somewhere in the country, but as of right now, we account for that second dose. We definitely want everybody to show up for the second dose, because that is what it's going to take to achieve what we know will be a great deal of immunity. So that 95% immunity can only come after that second dose. So I haven't heard of that happening in our local area, and our health system and the health department and all other systems in this area that I've had contact with, I know that they're all preparing and planning for that second dose.
The health commissioner says that he doesn't want Lucas County to be one of those counties known as a county that wastes the vaccine. So what is ProMedica's strategy in order to keep vaccine from going to waste?
Yeah, that's another really good question. I did hear about that vaccine provider in Ohio that actually lost their privileges. So we certainly wouldn't want that to happen to us or any other vaccine providers in the area. So we go to great lengths to communicate with the state and understand what vaccine we're receiving, what type it will be, because that the Moderna and the Pfizer vaccine both have different handling requirements. The Pfizer vaccine requires ultra cold storage, which there's only a few facilities in the area that are capable of doing that. And then when it's transported, it has to be transported at a very low temperature with dry ice. So there's a lot of steps and a lot of things that can go wrong along the way. So it shouldn't be surprising to any of us that that has happened, but we're attentive to that. We're paying attention to what's going on, and we're communicating with our vaccine distributors, which comes through the state. And we've actually had a lot of coordination with other healthcare systems. So there's been vaccine moving around the county already that we've participated in, and we're just being careful to know what we're using, what the handling requirements are, and making sure that we have the right number of doses for the right number of appointments, so that everybody who's scheduled to get a vaccine actually gets their vaccine, and we don't have any that goes to waste.
How many more vaccines is ProMedica expecting?
Well, it's a continuous process, Jaden. Every week we learn. So we learn every time we put on a vaccine clinic. We've across our system, we vaccinated over 12,000 people already. And just yesterday and today, we started into the community with our community clinics. I honestly don't know how many, but it was in the range of about 700 or 800 people. So you can see these numbers are ramping up quickly. And then we put in requests based on what we know the other healthcare systems are doing and how much of a population we have to reach across the the footprint that we serve and how many people are actually signing up for vaccines. We would actually like more. So if there's opportunity to receive more vaccine, we would be open to receiving more. We'd open up more appointments through our facilities, but these vaccines can only be manufactured at a certain rate, and the state distributes based on what they have. So as of right now, we've all in this area had a good. We've been able to keep up well. We could do more, and we expect that as time goes by, we're going to receive more allocations from the state just based on the manufacturing curve and how things ramp up over time.
Dr. Kaminski, thank you so much for your time.
All right. Thank you, Jaden.